All right, well, we're going to get started. We want to make sure that we stick to time and respect everyone's time. So good afternoon and welcome. My name is Anna Marie Golden. I'm the Director of Community Relations for Baystate Health, and I'm delighted to see all of you here today. Thank you for making time for us. At this time, I am pleased to introduce to you our MC for today's event, who is a Baystate colleague, Kara Woolridge. Switch the slide here. So Kara is a proud native of Springfield, Massachusetts. She is a graduate of the historically Black College University, Coppin State University, with a Bachelor of Science in Sports Management. And she received her Master's of Science in Occupational Therapy from American International College. Kara is also a licensed occupational therapist in Massachusetts and currently works full-time on the Adult Inpatient Psychiatric Unit at Baystate Noble Hospital in Palmer. Additionally, Kara is a member of the Springfield Technical Community College Foundation Board and community service organization Delta Sigma Theta Sorority, an organization that plans, coordinates, and implements community programs that benefit and support Black and Brown communities in the greater Springfield area. Through her professional and community work, Kara advocates for justice, equity, and community development for all groups and individuals served in and around Springfield. Kara is also currently a participant in Leadership Pioneer Valley's LEAP class of 2021. Kara, I want to just say thank you again for accepting our invitation to serve as today's MC. We're delighted to have you.
Thank you so much, Anna Marie. Welcome to our event this year, the 2021 Better Together Virtual Award Ceremony. A couple of housekeeping. I would love to invite you in your name to rename your pronouns in your video. I also want to remind you to mute your microphone as people are speaking and presenting. Just because this is a virtual event does not mean we cannot be engaged. So as you see at the bottom, there is a reactions button. So I encourage you to use those reactions to keep engaged throughout the event. You can celebrate people as they're being awarded. You can put a heart if you love something, as you see Brittney just did. You can put a thumbs up to celebrate. There are tons of things that you can do. This presentation is being recorded and will be posted to the Baystate Health YouTube channel. And if you have any questions, if you want to give any shout outs, please make sure that you use the chat function on the Zoom. So as you know, we have a great program planned out for you honoring the grantees of the 2021 Better Together grants. And it is now my pleasure to introduce Dr. Frank Robinson, Vice President of Public Health for Baystate Health, to say a few words.
Okay, great. Well, I am unmuted, so that I'm off to a good start already. So good afternoon, folks. I have the privilege and the honor to welcome you and as a senior leader here at Baystate to open up this phenomenal occasion. I get the privilege of doing a little bit of retrospective, a little bit of history. The Better Together grant program was invented in a conversation between me and Anna some 7 years ago. We were trying to figure out, what do we call this thing? And well, the Better Together rose to the top immediately because it means just what it says. If Baystate as a health system works effectively with our community partners, then we're better together, right? Doesn't that, it has certain kind of common sense sort of rhythm to it. And what we know really is that healthcare can only impact and change community conditions to the extent to which we're engaged fully with our community partners. And our limitations are dwarfed by the kind of synergy that's created when we actually can connect in a seamless way with community-based organizations, and we're allowed to invest time, energy, and effort in this community-facing manner. So my retrospective again, takes me back some 6 years or so to the actual naming of the Better Together program. But I think what folks may not know, and I'm going to tell you a little bit about how the sausage is made, how this program actually happens. I think we probably, in terms of this grant cycle, spent probably a good year getting ready to launch these grants. COVID got in the way. We worked our way around that. We made substantial investments, sort of driven by Ben Wood, or excuse me, I mean by the Mass Department of Public Health, reframing this notion of social determinants of health and environmental solutions. And quite frankly, it allowed us some latitude to play with ideals around how we might make significance or an important difference in our community. So in some ways, the tension that exists between our regulator or accreditor, or I'm not sure how we want to label the Department of Public Health, and the work we want to do here locally is positive tension that actually created some solutions that probably would not have existed in the old days of community benefit grant making. So I want to, again, recognize that we are in a special place, if you will. And I think, quite frankly, I think we lead the state in innovative grant making and grant making that is superiorly authentic in terms of community engagement. So folks that know me know that I'm a process kind of person. I like to be sure that we get the process right, we get people involved, voices heard. Sometimes I can do that to a fault. But I would acknowledge fully that Anna and Brittney have picked up my good habits, and that the process that they laid out engaged both our community benefits advisory councils, the general public, outside content matter experts, to actually shape a grant making program in terms of this last cycle that was probably one of the best I participated in and have witnessed. So again, I want to use this welcome to of this in this opening to sort of recognize some of the sausage making that's going on behind the scenes, and the fact that it's taken us a year to get to the launch of the program, and then to be in this place of actually making the awards. Now, as the awards came through, I didn't know any of the awardees because I was not involved in the selection process, but after the awards were announced, it was crystal clear that our process worked. You're going to hear about a set of phenomenal programs that are clearly evidence-based, outcome-oriented, remarkable programs, all of which I've had some engagement with at some point in time in my long extended history. I'm old. So I'm going to stop talking at you and get out of the way and move into the program and hearing about our awardees. And stay tuned. There's more to come. And I'm not sure if Anna and them are going to talk about that today, but there's more to come, and we look forward to working with each of the awardees over the next 3 years. So with that, I'm going to pass the ball back to Kara and get out of the way of the program.
Thank you so much, Frank, for sharing the ingredients to the Better Together grant that has been developed over time. Please use your reactions as we welcome Ben Wood, Director for the Division of Community Health Planning and Engagement at the Massachusetts Department of Public Health. Thank you so much, Ben, for being with us, and we look forward to hearing from you today on behalf of DPH.
All right, Kara, thank you so much. And thank you, Frank. My name is Ben Wood, and I do work for the Massachusetts Department of Public Health. I am not the Massachusetts Department of Public Health, however. I direct the Division of Community Health Planning and Engagement. One of the activities that we do is oversee how hospitals fulfill their requirements to invest in community health initiatives that result from this thing called the Determination of Need Program, which is a whole thing, and probably could use lots of explaining, but not for the purposes of this forum. The important thing about the Determination Need Program and the Community Health Initiative piece of it in particular is that it results in critically important resources to do critically important work to make all of our communities healthier places to live. So I'm really here just to celebrate all of you and to celebrate and give kudos to Baystate. So I have known Frank and I've known Anna Marie for many years. I've gotten to know Brittney over the past year or so, I guess, which has been a true pleasure, Brittney. And we really do value working with them a lot. It really is a collaboration. It's not a typical government regulator type of a relationship. The intent of the Community Health Initiative Program is to do what Frank was talking about. It's to see health systems use their resources to really address the conditions in communities that lead to poor health and lack of opportunity, to really work to address the systemic and unfair inequities in health outcomes and again in opportunity, and to make decisions that are transparent and actually in partnership with people, and move away from a real top-down decision-making type of an arrangement and environment. And on all those fronts, we see Baystate doing really good things, as Frank said. So just a couple of highlights. We really value the way in which Baystate is choosing to make funding decisions and decision-making processes that see resources go across the entire health system, right? So even if there is the Community Health Initiative dollars are resulting from a particular project in a particular community, Baystate is seen as an opportunity to spread those resources widely and to address need across the entire region. And how decision-making processes really are set up to be tailored by context and by community. We really, as Frank said, we really value the work of relationships and process. We think that that's really what this work is all about. And Baystate has been a leader in creative thinking around inclusivity and capacity building for community organizations through its grant making, so that it's not only the organizations that get funded that can get something out of participating. And we also really see Baystate trying to tackle big problems. We see you guys doing that too in the work that you're getting funded to do. It's hard work. I know in the language that we use, doing this upstream stuff where you're really trying to address the cause of a problem rather than just continuing to apply band-aids to the same old problem, to the same old symptoms and the same old manifestations of problems. That's hard work, and we recognize this hard work, and we're really grateful that you guys are all jumping into it with all of us. So anyway, wanted to celebrate all of you. Congrats on getting funded. Good luck good luck with the work that you're going to do, and we look forward to seeing its impact. And I say that with a lot of personal interest too, because I'm a Western Mass person. So good luck, and pass it back to you, Kara.
Thank you so much, Ben, for the work you're doing and representing Department of Public Health as they collaborate with Baystate to make changes in our communities in Western Massachusetts. Please welcome me and join me in welcoming Brittney Rosario, Community Benefits Specialist for Baystate Health. Brittney's leadership at Baystate Health has successfully launched and implemented its first system-wide Better Together grants request for process proposals. Please welcome me as she comes and speaks to you.
Hello, everyone. Good afternoon. Thank you, Kara, for that introduction. And just want to take a moment and say thank you again. I feel like you're going to hear that all afternoon. Just thanking you all for taking your time to listen in and hear about this process and join us in celebrating our grantees. So, Anna, I don't know if anytime you want to pop up the slide and then I can keep on chatting away. But first of all, I'd like to thank a couple Baystate leaders that are in the room with us, Tejas Gandhi, Nancy Shendel-Fallick, Molly Gray, Mike Knappich, our leader here in the Office of Government and Community Relations. Thank you so much for joining us. We're really excited to share these grantee highlights, not just with our community members, but also our fellow colleagues in the health system. So as you can see on the screen here, there are a few highlights of this Better Together grant process that we had for 2021. It was a super competitive process with over 75 people, intending to apply through a letter of intent. And at the end, we had 55 proposals submitted across our system. So just pulling us back a little bit in the story of where this grant funding is coming from and where it began. Baystate Medical Center decided to do a project to upgrade their electrophysiology catheterization labs, big name. And that project was actually approved in November 2018 by the DPH Public Health Council. So from November 2018 so now it's been a long road, a few years, but we're excited to put this funding to use and being able to invest it in some really worthwhile organizations. So the total cost of this project was about $37.6 million. And at the end of the day, after taking off, our fees for administration, money back to the state, we had a total investment of $1.2 million. So, we gathered our 4 hospitals and said, this is our funding, this is what we have. We don't want to keep it all at Baystate Medical Center. We want to be able to spread our dollars throughout the system, recognizing that some of our community hospitals might not have the opportunity to have a big project where then they'll have these community health initiative dollars to invest. So this was the first time that we divvied up the funding throughout to each hospital. And we're really excited to be a leader in that. As Ben was saying, it's the first time it's really been done in the state, and we're still learning a lot. And the formula we created wasn't perfect, but through communication with our community partners and some internal leaders, we were really satisfied and content at the end of the day with how this process carried out. So over 5 million in requests, or about 40 people helping us review proposals. BMC, Baystate Medical Center, was definitely the biggest pot. It took about three different sessions to make our decisions, but we're super thankful for everyone that was part of this process. Throughout the way, we really tried to continue to create capacity building opportunities for our applicants, but also others in the community that just want to learn more about how to write a good grant. So as part of the Better Together grant process this year, we were able to host a series of 4 workshops ranging from, cultural humility. What is that? What is this term that we're hearing nowadays about being culturally humble? Learning about how to create a logic model or work plan template, how to do data searching. We're recognizing that we don't want to just keep pulling in the same players in this game. We want to reach out to new organizations, grassroots organizations, and also help equip them as best possible to be able to apply for this type of opportunity. So I just want to thank everyone that was part of this process. That again wasn't perfect, but we're continuing to improve, hopefully year by year. So this is just another visual of those that apply, the 55 organizations that applied. We thank you all. We know that our application wasn't easy. We heard it was kind of intense, but we're super excited to celebrate with you all and hope that, when future opportunities come up, that you would consider applying again to the Baystate Health Better Together grant. And a few shout outs. So we could list a dozen or more people on this screen, I feel, but just really quickly highlighting some of the folks that really were an integral part of this process. One, I want to start off, Courtney Borns was our consultant that we brought onto our team to really help us stay on track for this project. As you imagine, if you know Anna Marie, she's always busy. I feel like I'm heading in that direction too. So having Courtney's support in this was super instrumental. So Courtney, I know you're there. We can kind of do a virtual wave and celebrate you. Others that we would like to thank are Community Benefit Advisory Council members, the design team, the RFP task force, as we called it, that gathered to create these applications. Our grant review team members brought a diversity of expertise and lived experience. We celebrate you, we thank you. We had a mix of youth, and community residents and Baystate employees that were reading proposals, some of them for the first time. So it was a great learning experience for them all. Public Health Institute and our TA team with Kathleen Zegda, Kim Gohui, Bonnie Shepard, and Mary Nash, we thank you. Women of Color Health Equity Collective, Margot Malachowski, I know you're there too, Margot, thank you. Ben Wood and Jenica at DPH. And I would also like to thank our marketing and communications team at Baystate. You know, everything we do from the flyers to the recordings to the Baystate YouTube, they're kind of the ones that help us carry that out. So we thank you all so much. So with that, I pause. I invite folks to use the chat and celebrate these people. We're super excited to have you all on our team.
Thank you.
Awesome. Kara.
Thank you so much, Brittney. And yes, please just use the reactions and just celebrate those people that she listed. I don't think any of this would have been possible if it was not a collaborative effort. So now we've reached the part of the program where we get to learn about the grantees. For this grant process, due to the source of funding in Massachusetts, the Massachusetts Department of Public Health requires hospitals to focus on one healthy priority, also known as social determinants of health. The 4 Baystate Health hospitals, in partnership with their respective Community Benefits Advisory Council, also as you've heard throughout, called CBAC, selected a health priority based on the 2019 Community Health Needs Assessment and a subsequent priority setting process. Baystate Noble has decided to focus their funding on the built environment, while Baystate Wing Hospital and Baystate Franklin Medical Center respectively decided to focus on social environment. And Baystate Medical Center selected education, as you can see. So now we'll be hearing from members of each of the Baystate Community Benefits Advisory Councils, and they will introduce us to each guarantee. So please give a round of applause for Baystate Noble Hospital being represented by Beth Cardillo. Beth is an executive director of Ambrook Village in Westfield. In addition to serving on the CBAC, Beth served as a grant proposal writer and is also a member of the 2022 Community Health Needs Assessment Regional Advocacy Council. Let's welcome Beth as she introduces Baystate Noble's grantees.
Thank you so much. And I also work full-time. So I want to thank everybody for letting me go first. Ambrook Village is celebrating its 8th anniversary right today on April 1st. So we're very excited. So right after this, I have to do a champagne toast with all my residents because, you know, older people eat dinner at an earlier time. And I'm also doing a presentation on Passover tonight. So we're having champagne, gefilte fish, and matzah. What a night it's going to be. So thank you for letting me go first. Happy Easter, everyone. Happy Passover and happy spring. I just want to say it was a very exciting experience to be part of the review team. Courtney was on it and Eliza was on it. And I'm looking around to see who else was on the team with me, Brittney. Everybody did a fantastic job with everyone that we read, and Sunny was on it, and we poured over it for quite a few hours trying to come up with something. And given the year that we've had of COVID, I can't think of a better group of grants that we handed out for people. So I'm excited to present them to you. So we've got a total of $194,000 over 3 years to give out, and that's what we did. So the first one was the Food Bank of Western Mass. And I don't know here in this group who is from Western Mass from the Food Bank. If you are, can you raise your hand so we know who you are? Hi, Alan. So congratulations. Very excited about this grant. It's a 3-year grant for $84,500. And we love partnerships and we love collaboration. This is in collaboration with the Greater Westfield Food Pantry. So it's about expanding the current FISRI model, and everyone's going to say, what is that? That is Food Insecurity Screening Referral Initiative. Say that 5 times. So they are expanding that model by establishing, this is very exciting, a new non-clinical access point for one-on-one food security, case management, and referral services. So they'll be hiring somebody to work at the Westfield Food Pantry who will be a food navigator. That is not someone that walks around the grocery store as Instacart. They will work specifically with families who visit the pantry that may be missed in the traditional healthcare setting. And I'm assuming that they are going to try to be connecting folks with the other services that they can be getting in the community. So in the days of food insecurity and COVID and people losing jobs, this is a really exciting grant. And I congratulate the Food Bank of Western Massachusetts. So. All right, the second grant for Baystate Noble is Mental Health Association and Core of Greater Westfield. Anybody here from there? Who do we have that's right now? I don't see
I'm here,
hands.
Kim. No,
Hi,
I'm
Kim.
Kim Lee. Hi.
Hi, congratulations, Kim.
Thank
So
you
we're
very much.
this
I'm
is
on the
exciting.
road. I apologize.
Oh, that's okay. Drive carefully. So we're
Thank
talking
you.
about a substance use recovery coach. They'll be hiring a recovery coach for Baystate Noble service area to assist youth and adults engaged in recovery from opioid and substance abuse disorders. The coaches will engage with individuals both outside the clinic setting and providing face-to-face outreach. This is an $84,500 award for 3 years. And again, I can't think of a better time for this to be happening because we know that substance use, opioid use has increased this year and it's been catastrophic. So we're hoping for great things with the Mental Health Association. So congratulations. And the third one I'm really excited about because I work with the elderly, not because I'm old. This is with the town of Blandford, solving the digital divide for the elderly population. And I have to thank Sunny for this. And I can't remember, and Courtney, the whole group that we reviewed this together, because initially this really was a conversation about older folks learning to get laptops and doing things on the computer. We all recognize that older folks in the hill towns are totally socially isolated in the last year. And how are they going to get information to people? How are they going to connect to people? And if you think about it now, how the heck were they ever going to arrange for a COVID vaccine if they had to do it online? And I know Sonny shared a little bit about his own family. We all talked about, you know, we don't think that computers are going to work. Maybe we should talk about a tablet. And so this is really exciting to me. It's a 1-year award for $25,000, but I think it's going to make a huge difference. It's a partnership with the Council on Aging to assist older residents to connect to high-speed internet and provide a laptop or a tablet. And it is a part of digital literacy training. So it's not like we're just going to give people a laptop or a tablet and say, go on your merry way, because there it will sit and not do anything. So this will include the training and really looking at cultural humility training, which is so important for the Council on Aging staff, board, and volunteers. So I'm hoping for great things for all 3 of these grants, and I think they're very exciting. So thank you and congratulations, everyone. And I now have to leave to go do my champagne toast. So I'm leaving y'all. Thank you.
Thank you so much, Beth. Enjoy that champagne toast. We wish we could be with you.
I wish you could too. My pleasure. Bye-bye.
Take care. Thank you so much. And congratulations to all the grantees that have just been awarded from Baystate Noble. Next up, we have Baystate Wing, which is my home base, and let's welcome Michelle Holmgren. Michelle is a public affairs and community relations specialist for Baystate Health, specifically in the Eastern region. Michelle also serves as the co-chair for Baystate Eastern Region, CBAC. Please welcome me, excuse me, I keep saying that. Please join me as we welcome Michelle to the stage.
Thank you, Kara. So Baystate Wing selected social environment as our health priority. We selected this priority long before COVID started, but the pandemic has only reinforced the impact our social environment has on our health and well-being. In total, we had $239,000 to invest over 3 years. I was not part of the group that made the decisions, but I did join their meetings to act as a resource if they needed help making the decision. And I have to say, this was the most thoughtful group of folks that made these awards. I was really proud to be just in the room with them as they were working. And I know a lot of work went into it before they made the awards, but the night that they made their decisions, it was really thoughtful work these people did. So I thank them for that. So I'm proud to share the Baystate Wing grant recipients with you now. So the first award is to the Alzheimer's Association for Dementia Care Coordination. So they'll offer expansion of dementia care coordination program to the Baystate Wing Hospital service area. They'll set up referrals and training in age-friendly dementia with local providers and provide a network of support for our caregivers. They got a $50,000 award to use over 3 years. The next grant we made was to the Greater Springfield Senior Services for medically tailored meals and nutrition education. So they'll provide sustainable referral partnerships with area medical providers in Palmer and surrounding areas for their medically tailored meal program. This program provides tailored home delivery meals to consumers over 60 and their caregivers who have a cardiac, renal, or diabetic diagnosis. It really aims to decrease the social isolation while it also meets the basic need of older adults. The next grant we gave was to the Quaboag Hills Community Coalition Seeds of Hope. The Seeds of Hope are going to work and prepare at-risk individuals who are not pursuing a college education after high school for jobs. They're going to help them work to connect them with careers and services and resources. They're going to provide case management to address the social needs of those, who are 18 to 24, who are just, not sure what they're going to do after school when they're not going to college. They're going to provide job readiness training, connect them with local employers and career pathways. We had a little pilot program about this. It was a great program. It really helped a lot of our youth in the area who could be at great risk if they didn't have someone to shepherd them through that part of their life when they're, done with school and suddenly put out into the community without any plans. So it's a really great program, and I'm proud of the work they did. The Quaboag Valley CDC Financial Fitness Club. This group will assist low-income individuals reach savings and asset building goals through group learning and building social capital. The grant funding will actually raise the level of their saving with a matching grant. So this is really helpful for people who don't know how to save money or haven't had, an experience of opening a checking account or knowing how to do this. These guys do a great job of really teaching them the value of saving. So I know, I think I saw CDC in the room. I know I saw a lot of our grant people in the room, so I'm really grateful to you all for the great work you're going to be doing in the next 3 years. So the CDC totals award was $45,000 to use over 3 years to do this work. And lastly, the literacy project, building healthier lifestyles together. So the literacy program, the adult education course in WEAR will be offering opportunities for health, to learn more about healthy eating, physical activity, and stress management in a group setting. So the student advisory board will choose activities that determine what the participants want to learn for community building and learning. And I know Jessica's actually in the room. I saw her earlier. So I think this is really, this program has been very busy, even pre-COVID and after COVID. I know they're still doing a lot of great work with our adult learners. So we're really proud to support the work the literacy program is doing at WEAR. And we awarded them a little bit over $43,000 to use over 3 years. So those are the awards that we made in the Baystate Health Eastern region. And I thank everybody for the great work they're going to do in the next 3 years.
Absolutely. Congratulations to all of those organizations in the Eastern region. Before we move on, I would like to welcome and just kind of say thank you for joining us this evening, Senator Adam Gomez, for being on with us. It's a pleasure to have you here this evening and celebrating these grantees with us. Next up, we have Timothy Ranney-Blake, and he will be representing Baystate Franklin Medical Center. Timothy is with the Recover Project in Greenfield. In addition to being a member of the Baystate Franklin Medical Center CBAC, Timothy also served as a grant proposal reviewer, a role in which he fully embraced. So we just want to thank you for being with us today, and we welcome you to the stage.
Thank you all. It's a pleasure to be here. And yeah, I had a chance to grind up some of the stuff to put in the sausage casing. So that's that was and I have an opportunity to wear a tie. So I did that. The tie is actually an illustration by a child, and it was made into a print for a tie, and it goes funds go to the children's Save the Children. Anyway, so social environment was a topic that we chose through the CBAC, and I would just ditto what was said about the COVID safety precautions, making this a much more evident need, and I'm glad that we were part of that. So the people that I see community action is our we had 307,000 over 3 years, and community action Pioneer Valley. We liked the idea of the youth and young adult input in making some inroads into what we like, the idea of the friendly systems. This one was particularly youth friendly, but we are glad to see that many of the recipients were very much involved with making connections with people who have been traditionally underserved in some ways. And so the Community Action Pioneer Valley, we awarded $100,000 over 3 years. Next up, Just Roots. Just Roots supports farm fresh foods, and their history has been such that we were really excited to find out continue to their recognition that food is an entryway into those kinds of social environment improvements, and so collecting information about who they're serving, how they're being served, what their needs are, and all of that came to us in a very special way, and we enjoyed that so much, reading about their proposal. And so the award goes to to Just Roots over 2 years, over 108,000. And so the next one, Música Franklin. This organization was sort of new, and one of the reasons that I say it was sort of new is because it was one of those that once people got a little further out than the regular so-called folks who might apply, we were very happy to see this group apply. And they were very well researched in the underlying philosophy of how people get helped and how things can move forward. They were already very well practiced in cultural humility and health equity. And so it was a very big draw for us on that. And we like the idea that providing safe, welcoming environment for learning gives the younger people a buy-in to the kind of ways that they become community leaders as they go forward. The last one on our list is Stone Soup Café, which provides meals and has been doing so for the community. And very much like Just Roots, one of the things that Stone Soup found out that they do is they connect with people beyond the food. And so they are also, we're asking for money in order to support the data gathering of who they are serving, how they're being served, and what can be done. So one of the ways that we've already seen some many hands making light work is that Community Action has reached out to Stone Soup to say, we do some of this, can we help you? And that way they can get further in finding out where people are and who is yet to be served. And one of the things that's very, so their award is for a year at $38,526. And so one of the things that's common among all four of these that I wanted to get to is they very hard, thank you, Brittney, for bringing that up. Yeah, that was a hard response to make, and people did find it daunting a little bit. But these four all came through in a very, very real way to say they understand cultural humility, they understand health equity. It's also about, you know, things going upstream to say we can make a difference in the initial structures of our culture, recognizing that it's very white, it's very urban, and one of the ways that we can do something with these four is to recognize how to bring in all kinds of different folks. And I love the fact that we get a chance, among other things, to bust the myth about older folks not always having the best abilities to do things online. I've gone from boomer to zoomer, and we can do this with the help of these folks who were awarded these grants. We can find them better, we can include them better, and that way the structures going forward, not only with the younger folks, but a conglomeration of the older folks, bringing in the experience. So we are better together. As we say in the recovery community, recovery happens best in community with other folks with lived experience. So that's why I was happy to. And I just also want to give a quick shout out. I know Tina Dean and Cheryl Pescucci are in the room, and they were part of the grant review team that I was with. And so, so congratulations to all the awardees. I'm not sure who else is in the room, but I know Kristen's in the room. So thanks, and I think we'll leave it there.
Thank you so much, Timothy. Boomer to Zoomer. If that's not something to be encouraged about, you know, as a result of COVID, I don't know what is. That was awesome. Thank you so much again. I would like to introduce Brittney Rosario. She will be representing, Baystate Medical Center. And at this time, I just want to have her introduce the grantees that were from Baystate Medical Center. So thank you for coming.
Thanks, Kara. So I had to fill in. So we had another wonderful CBAC community member that was going to do this presentation, but unfortunately felt a little ill. So I'm here, but in her place, but super excited to announce the Baystate Medical Center grantees that had the largest amount of funding available, $515,000 over 3 years. So the first grantee up here is Boys and Girls Club of Greater Holyoke. Congratulations. I know we're going to continue with our emojis and our round of applause. So they were funded $93,000 over 3 years to address the mental health needs of the youth in their programs at the club. They're specifically looking to hire a social worker who will help offer not only counseling, but facilitate stress reduction activities, assist with case management, educating them on mental health, social emotional health. So super excited to see the wonderful work that is going to happen there. This is the first time they'll have a social worker on their team. So I know folks at Boys and Girls Club are really excited to leverage these funds for that. Next, we have the Community Adolescent Resource and Education Center, also known as the CARE Center, that was awarded $120,000 for their Bard Microcollege. So if you don't know about them, look them up. They're amazing. So the CARE Center works with low-income parenting young women and help them earn a 2-year college degree. And not only do they do the education piece, but they have wonderful wraparound services like on-site childcare, health education, meals, transportation, even on-site medical services. So whatever these mothers and women need in order to complete their educational goals, they do their best to offer. And they're looking to expand their program to serve 70 students over the next 2 years. So congratulations, CARE Center. Girls Inc. of the Valley, growing the Girls Inc. experience. So Girls Inc. received a $60,000 award for 3 years to continue expanding their reach in the schools through Girls Inc. And helping to improve the health outcomes by strengthening girls' social emotional skills and also increasing their educational attainment. So if you're familiar with Girls Inc., you know they do a ton of things, but all in conjunction with academic support, with social emotional support as well. So they're hoping to reach 1,000 girls through their program in the schools by their 3rd year of implementation. So congratulations, Girls Inc. Project Coach. So Project Coach was actually one of our previous grantees for another Better Together grant. And according to our grant review team, they said we want to fund them again. So super excited to be able to award Project Coach a 2-year grant in the amount of $112,000. Project Coach works with Smith College and the Springfield Public Schools, and they help high school students become coaches for younger elementary school students and use sports as a way to connect. They do a lot of social emotional skill building through sports and mentoring. And we're super excited to be able to help them expand into 2 more schools this year through that funding. As you know, it's been a challenge for our students to stay connected, to stay engaged, and to reach their educational goals with COVID. So Project Coach has definitely been a bridge for many students. Congratulations. And then we have ROCA. So ROCA's program, Educational Advancement Project, is looking to address the educational needs of their high-risk young men and young women who participate in their Hampden County kind of region. If you know ROCA, they're kind of all over the place in the country, but we have our wonderful ROCA staff here in Springfield, and they work with folks who have experience in the criminal justice system or have experienced trauma, and they're not only helping these young people endure and kind of get through the trauma, but also helping meet their educational goals. So they'll be using kind of a cognitive-based therapy model to be able to help advance that. So congratulations, Chris, and those at ROCA. Am I missing one more, or did I get through all of them? Yes, there we go. So another big congratulations to all our grantees. We have 17 in total. In a moment, I'll share some next steps and where we're going, but continue shouting folks out in the chat. It's lovely to see all the support. And to Tim's point about building connection and having grantees talk to one another, we've seen a lot of folks collaborate and wanting to collaborate more on these projects. So that's our hope and vision for this Better Together grant program, that we don't keep doing things in silos, but we build communities that support one another and care for one another personally, but also in the work that we do. So congratulations again.
Thank you so much. I just want to say thank you to Beth, Michelle, Timothy, and Brittney for introducing us to the grantees. And these organizations are creating change in the communities that we live and work in, collaborating with Baystates, and these grants being provided to them are allowing them to make these changes. So yet again, in the chat and with your reactions, just show your appreciation and celebrate with us the awarding of these grantees for these funds. Brittney, is there anything else that you want to say?
Yes. Yeah, so a couple more things. Where are we going now? If you haven't already seen, we really had a press release out there to announce and share a little bit about our grantees. There's some wonderful quotes in there. But now our grantees are going through an evaluation and technical assistance assessment with the wonderful staff at Public Health Institute of Western Mass. So they'll be tidying up all their work plans and getting ready kind of to really start in the work. So a couple of learning opportunities are going to be happening for our grantee cohorts in this model that we're calling community of practice. We want them to continue learning together and growing together. So more to come in terms of trainings and support for our grantees as best that we can offer. But as always, if there's folks that in the room who you have something, have a training, a curriculum I think they could benefit from, please, as always, communicate with us. We would love to help you share that learning as well. We also are developing a white paper in partnership with Courtney Borns again to track this Better Together grant process, and from beginning to end, what did we do? What were the steps that we took as a way, one, for us to measure our opportunities, where do we have room to grow? What were things that worked really well? And we're hoping that this white paper can serve as a resource for other entities looking to do community-informed grant making. So we're excited that that's almost finished, and we'll be sharing that with our community members as well. Future capacity building opportunities will continue coming up. As I mentioned, this isn't just for grantees. I think earlier I mentioned about our workshops that we held. We're looking to continue opening that for the community and making it a free resource and kind of eliminating all the barriers to learn about a lot of different kind of up and coming topics that we're hearing the words and now we want to learn more. Promotion of grantees, you'll see our grantees represented in our newsletters, in our website here at Baystate, our Baystate Health social media, as well as our Community Benefit Advisory Council. So if you're a grantee, start getting ready, as I've been saying, to kind of circle back to the CBACs and give your updates to the group as they're itching and waiting to hear a little bit more about the details of everything. And last but not least, to close us off on a high note, we were approved another DON Community Health Initiative, a round of investments last December. I think that deserves a really big round of applause. So as part of Baystate Health's Hospital of the Future project, we will be renewing, I think it's 17 Baystate Medical Center operating rooms. And that project was approved, which means we have more money, which is rare, right? This is episodic funding. This is not funding we always have. So it's amazing that we can do this 2 years in a row. So it's going to be a $2.2 million investment with $1 million going into some regional initiatives that we're looking to do across our health system. So folks like Frank Robinson are helping us with that. And then there's another 1.2 million that will be invested through a similar request for proposal process, where we'll be taking all the learnings, all the feedback that we got from our grant review team, from applicants, from our grantees. We're going to try to make some upgrades and get ready for another RFP late summer, early fall. So more to come on that. And we're just super excited to be able to continue engaging our community partners in that process, where we will be seeking insight from our CBACs, from the county health improvement plans, from our community benefit forums that we have coming up in June. We continue wanting to hear the community's voice in these processes and make sure, as Ben was saying, that we're just not top down making decisions, but really hearing what's dear and near to our community members. So that's my spiel. Thank you again so much. If you have any questions about anything that I mentioned, as always, Anna Marie and I are here.
Thank you so much. And thank you all for joining us this evening / afternoon as we celebrate the grantees who've been awarded. And as Brittney just described, there's a ton of opportunity for more work and collaboration with the community to continue to develop and improve Western Massachusetts. So thank you again for celebrating with us. Continue to celebrate on your own. Have a lovely weekend. Happy Friday, Junior. And have a lovely evening, everyone. Have a good night. Goodbye.
Wait to see you all.
Have a good night.